Good morning. When the COVID-19 pandemic hit our community, we knew that we had to do everything we could to save lives and prevent the devastation that we saw around the country and in other parts of the world. To do so, we issued early stay-at-home orders much sooner than just about anywhere in the country. But in doing that, we also knew that this would impact our local economy significantly. When we learned that we would be receiving Federal CARES Act stimulus grants, we decided immediately that we would create a program, a small business relief program, to help some of our businesses that would be most affected by the COVID-19 pandemic. There's been significant interest in this program, and today we'll talk about how that's come along and some of the announcements and some of the awards. We based the parameters on this program from information from the Federal Reserve Bank of St. Louis. And their research indicated that small businesses with 50 or fewer employees were the most likely to be affected by the economic downturn related to COVID-19. And that's why we created a program focusing specifically on small business. When we announced the relief program, we made it clear that we would do everything possible to meet the strict guidelines from the U.S. Treasury and comply with their requirements and restrictions. We asked our outside accounting firm, Reuben Brown, to make sure that we screened all of the applications appropriately. The screening includes, among other things, verifying that the businesses are in good standing, that they're not on the Missouri Revoked Sales Tax list or on the federal exclusion list. Our preliminary numbers indicate that we have 1,696 applicants that have made it through the screening process. The total amount requested is $19,285,000. Unfortunately, many businesses face challenges obtaining all of the appropriate screening material and documents. So I have directed my staff over the past few weeks to work with these applicants and help them obtain the necessary documentation to get through the screening process. So I first want to thank all of the county employees who made many phone calls, answered any emails, and helped our applicants obtain the proper information to get through this process. The first round of emails will go out today indicating some of the recipients of these federal grants. And then by Friday, the first checks should be in the mail. And then over the coming days and weeks, these applications will continue to be processed on a rolling manner as we obtain the necessary documentation and help these applicants comply with the screening process. We originally set aside $17.5 million for the Small Business Relief Program. Because of the amount of funds requested, only exceeding the budgeted amount by less than $2 million, I've asked our County CARES team to rework the budget to make sure that all eligible applicants could receive funding. I will continue to assign the necessary staff needed from my office and from St. Louis County to help these applicants with the screening documentation and make sure that they know how valued they are in St. Louis County. And the Economic Rescue Team that I have appointed will continue to use COVID-19 relief funds to help our small businesses and look at the government regulations to help them get back on their feet as quickly as possible. The County CARES budget also has an additional $5 million of economic relief funds, and we will be working with our Economic Rescue Team to come up with ideas on how to make sure this is distributed in an equitable and fair way to support our small businesses. The 6-person Economic Rescue Team, all volunteers, will not be making policies, but they will help determine the best way to assist businesses during this recovery. They have 4 working groups. There's a working group focused on minority and immigrant-owned businesses, small business and industry, community development, and workforce development. The team was ultimately designed to ensure that the voices of small businesses and the workers were heard in this recovery process. And this team is working diligently to help us move through this crisis. During the response to the COVID-19 pandemic, we also had some good economic news for St. Louis County. The 3 bond rating agencies all gave St. Louis County superior marks for their economic management. This news comes as local governments across the region and across the country are facing challenges related to the economic downturn associated with COVID-19 and other challenging events. Moody's Investors Service gave St. Louis County its highest rating, praising the county's conservative budgeted practices, prudent financial management, and sustained, stable, and economic performance over the long term. Fitch Ratings also gave St. Louis County its highest rating. They praised the early stay-at-home order and our decision to stop all non-emergency spending as soon as the COVID-19 pandemic hit our region. Standard & Poor announced the county maintained its highest ratings due to its stable outlook and stated the county is well positioned to handle the pandemic-related recession during the next few years due to strong financial management. The county is not immune to economic challenges that's facing our community or our country. Like other organizations, we've had to make some tough decisions. But we're proud of these ratings, and we look forward to working through these challenges. 2020 has certainly been a very tough year, and I'd be glad to answer any questions.
What are some of the requirements for the small business money that you're talking about?
COVID-19 related expenses, reopening guidelines, complying with social distancing, taking care of their employees and their patrons in a safe and responsible way.
County Executive Page, little off topic, but when Michael Neidorff made his comments the other week, he specifically mentioned MetroLink and some of the safety issues there. And in February, when the new safety agreement was rolled out, there were still negotiations going on between the city and the county police departments on your plan to add more officers. Has there been any progress on
yeah,
that?
the officers have been on, our county officers have been on the train in the city and in the county at increased numbers for several months now. Mr. Neidorff might not have been aware of that, but I would just refer you back to the county police department for exactly what's happening and to Bi-State. But our county police department, our county officers have been on the train for some time now.
As many as you asked for?
I believe so, yes. I haven't asked that question in several months, but it's been several months since I was given assurances that would happen, and I believe it has.
Have you heard specifically from Michael Neidorff or anybody at Centena about that issue in particular, Metro?
We haven't talked about that issue in a while. I haven't heard anything about Metro, but we know for the past 5 years that public safety on Metro has been a source of great controversy. It was a source of great controversy under the prior administration, but we have a much better working relationship with Bi-State now. They just came before us yesterday for the county council for their budget hearing. It went very smoothly. This is the earliest their budget has been approved in years, and we have a much better relationship. There's a much better relationship on the security and safety side with all 3 jurisdictions, St. Clair County, the city of St. Louis, and St. Louis County, working closely with the new leadership over security at Bi-State. We believe we've come a long ways. We certainly were in a tough position a couple of years ago. Even a year ago, we were struggling, but we have a much better relationship now. The safety study has been implemented and is ongoing.
Thank you.
Should we be spending more money on rapid testing and result efforts with all the new cases in the county?
Cases are up. There is a bump in the county in cases. The average number, I believe, is around 60 or 70. It's up about 40% over the past 3 weeks. We're watching it very closely. We're not just watching the number of positive tests. We're watching the positive to negative ratio of those tests. I believe it was 4.8% yesterday. There was a big bump in positive tests yesterday, like 130 or so. But if you look at the 7-day average, it's stable at around 70. And sometimes, because of the delayed testing through Quest, sometimes we get those results in bunches. And it's important to look at that 7-day trend and still, instead of 1 day. We have many people in the testing space. Health systems were the only ones in the testing space early on. But since then, there's a lot of private lab activity. The FQHCs are testing in St. Louis County, and St. Louis County Department of Public Health has a big testing footprint as well. There's different technology. The PCR testing, which is a nasal swab that goes very deep back into your nose, it's pretty uncomfortable. That's the best kind of test. It's the most accurate. If those are run here in our region at the health systems, then we get the results within 24 hours. If they're sent out, sometimes it can be a few days, sometimes a week. Quest is facing a backlog nationally because of the explosion of COVID in the rest of the country is consuming a lot of the testing supplies. It's stressing the testing system, and we're feeling a little bit that here in St. Louis for some of the tests that go through Quest. Quest handles about half of the tests in the country. So when they're stressed, it puts a stress on the entire system. There are different testing systems that are available. Some of the rapid tests are not quite as accurate, but in some settings they do provide valuable information, and we've incorporated that into our testing protocols in the county.
Who gets rapid testing then?
Well, some of those are, we use some of those in a setting where we need results quickly, and the rapid testing is through the Abbott machine, and we have some of those Abbott machines here in the county. I would have to refer you to the county health department about the details of the testing strategy in the community. I know some of our health systems now can get tests back for patients in the hospital in the same day, and as few as an hour and a half for the quick tests, and then the more routine tests, they can get the results back in 8 hours for hospitalized patients. I think we have to recognize that people who are really sick are the ones we need the results the fastest. So there are tests that give us results quickly that aren't necessarily marketed as rapid tests. Some of the tests marketing as rapid tests will give you a positive result, but you also have to follow up again and make sure that it's a true positive, because some of the rapid tests that are available outside the hospital are not quite as accurate as the nasal swab test.
Are those about as percentage-wise for positivity, false positives? Are those about the same, rapid versus the other?
Some of the rapid results tests, especially the IgM antibody test, has a higher false positive rate, and that's why some of those tests, depending on the brand, need to be followed up with a PCR swab. And again, it would be important to make sure that each individual gets the information they need for their specific case to find out what test they got exactly, what the false positive rate of that test would be, and whether or not they would need a follow-up test. Any questions? Okay.
Sam, I have one.
Yep.
From the Post-Dispatch. Last night, the County Council approved a bill requiring volunteers with final decision-making authority in advising CARES funds to file financial disclosure forms. Republicans said the bill doesn't go far enough and that the administration isn't being transparent. How do you respond to those allegations?
Well, there occasionally in County Council, not often, but occasionally there are partisan differences. The partisan differences related to COVID spending really started at the beginning because the original appropriations bill directed the funding and the appropriation to go to the areas of the county that were the most impacted by COVID-19, where there was the most devastation. And that early on created some partisan discussion about spending, and that generally has spilled over to political rhetoric around transparency. But the County Council voted on a bill last night to require financial reporting for anyone that has financial oversight, and that sounds reasonable to me. For people volunteering with county government, putting them through those more stringent requirements can be equivalent to harassment, and that was a position that the County Council took.